Hello, Dr. Ian Barrett, back again with another video series regarding various weight-bearing requirements after surgery. So it's somewhat of a mystery sometimes when we tell you how much weight to put on your leg after surgery. So I'm going to try to demystify that today. So first thing, weight-bearing is tolerated. Pretty simple. We throw that term around a lot, but to everyday citizens, maybe it's not as understandable. But weight bearing is tolerated does not mean you have to put full weight on the extremity, but means that you should limit it by the amount of pain that you have. So often after something like a simple knee scope, we'll say you'll be weight bearing as tolerated, and that means you can try to put weight on it, but we want you to be very cognizant of how much pain you're having in the knee and slowly acclimate it to adding more weight. So you'll end up using your crutches early on just to help take a little bit of weight off, so you'll feel a little bit of weight in your hands. And this can actually significantly lower the amount of weight that's going through the leg, just even feeling some light pressure on the hands. But it can help alleviate some of the acute pain from the inflammation of surgery. The next type of weight bearing that we often talk about is called partial weight bearing. So the amount would be set by your surgeon, hopefully me, at some point. And this can range anywhere from typically what we call touch weight bearing down to up to 80% of your weight. Now, touch weight bearing essentially means that the leg that is affected after surgery or from the injury is allowed to rest on the ground like this, and the weight of the leg can be used simply for balance while standing upright. Now, this doesn't mean you can put full weight on the leg even when you're standing still. The leg should be in a slightly bent position when it's positioned on the floor. And when you're moving, you want to put all the weight on on the non-operative leg. So you're going to come through with the non-operative leg. This one just rests on the floor alongside it. Okay, so I'm not putting any weight, just the weight of the actual leg on the floor. Do that one more time, if you can see it in slow motion. So this one is coming down. This one is resting beside it. Coming down, resting beside it. Okay, so that's touch weight bearing precautions. Partial weight bearing, if your physician tells you 20, 40 pounds weight bearing, usually we start about 40 because touch is basically the weight of the leg is at least 20. So for a 40-pound weight bearing, you'd have to get a personal bathroom scale or a scale at the gym, doesn't really matter, and you would stand close to it and then place your foot down and add an increasing amount of weight until you achieved whatever that restriction was. So when you get to 60 pounds, you should have a good idea of what that actually feels like to put 60 pounds on the leg. And then your goal is to recreate that when you're walking. So when you come through, I'm putting a little bit, I'm still compensating to get that amount of weight through the foot that we talked about at the gym. Now, that can be challenging, but the goal of that is twofold. One, to reduce the amount of stress going through the injured area, but then two, to actually provide a biological impulse in the form of mechanoreceptors that exist within your soft tissue as well as your bone to promote a healing response. So that's usually why we choose a partial weight bearing protocol. And finally, full weight bearing, of course, no crutches, and do whatever you like. So if you have any questions, always feel free to ask your surgeon. Your physical therapist will also be a great resource going forward in determining if you're doing the weight bearing restrictions that were assigned to you appropriately. Thanks.